this is Anna Basevich, VP of Customer Success at Arcadia. I'm going to share a bit about Arcadia and the challenges our industry has faced over the past year, and talk to how we've partnered with AWS to enable health systems to engage patients in staying safe and getting vaccinated during COVID. Arcadia is a healthcare data platform company, and we're committed to enabling healthcare transformation across the country. As healthcare payment models are evolving, healthcare organizations are relying on large data sets and tools that make information on their patients easily accessible. We manage data on over 130 million patients in an end-to-end, high-trust certified platform. I want to share a bit about what our customers have faced in the past year. We've all seen versions of this graphic, but I'd like to take you through it through the eyes of a health system. The early surge was incredibly challenging for healthcare providers as hospitals were overwhelmed with the early COVID cases. As doctors and nurses navigated emergency rooms and ICUs, many didn't know what to tell patients about staying safe, as the information was limited and guidance was inconsistent at best. As the weeks wore on, we started to see the impact, not just in hospitalizations and the immediate death counts, but in broader impact to population health. We saw patients not getting the care they needed, even in urgent situations, as they tried to stay home and not risk exposure to the virus. And that has long-lasting consequences, as we saw preventative care drop similarly, causing public health experts to raise concerns about the long-term impact of children skipping vaccines and regular well-child visits, and adults forgoing important care for conditions like diabetes, COPD, and hypertension. But now we're starting to see the light at the end of the tunnel as health systems are tackling the national challenge around vaccinations. These groups have dealt with short supply being made available to a decentralized system, but the longer-term concern here is around vaccine hesitancy. While so many of us are eager to get vaccinated, many others have concerns around using such a new vaccine. So, where does Arcadia come in? We work with our customers to assemble comprehensive and timely data sets from a range of systems and pull that data through a market-leading business rules engine that calculates quality measures, risk and impactability scores, and all the metrics that are critical for informing healthcare organization strategies. We present those insights through analytics and reporting, and a series of point-of-care and care team tools that are designed to help frontline caregivers act on opportunities to drive improved performance and deliver the right level of care. I'm going to take you through how we provide the data pipeline that enables our customers to do this work, and how we use AWS. To orient you, on the left side is how we bring in data, and as we move to the right, we see how we process and enrich this data and layer applications on top of it. I'm going to focus on our data ingestion tools and stratification algorithms, and then dig into our patient engagement tools and the customer success stories. So the gateway is how we bring data into the lake. We're typically bringing in data from electronic health record systems in hospitals, primary care and specialty offices, as well as health plan claims, alerts from health information exchanges, lab data, and more. And this range of data sets helps us build a comprehensive and in-depth view of each patient. We use AWS IoT Core, which gives us shadowing and digital certificates that enable us to manage the extraction agents that we use to pull data from EHR systems. And that data lands in our lake in S3. We use VPCs with layered security throughout to ensure that the data stays safe. And we know that that's table stakes in healthcare. In the lake, we cleanse and normalize the data. Our master patient index matches and links charts across systems to create longitudinal patient records. We then use terminology mapping to process pseudo-structured fields, apply natural language processing to clinical notes, populate enrichment tables to scrub coded data, and incorporate reference data. Through that process, we're using lambdas in conjunction with EC2s, which are spinning up to handle the data volumes. And that scalability is key. Some of this data comes through in batches, so these servers are on when we're processing, and they automatically go dormant when we're not using them. As data moves through the process, Amazon SQS is facilitating messaging across all these components to keep them coordinated. And finally, Glue is processing the data and dropping it into Elasticsearch. At the end of this process, we've got all this data groomed in a single schema that's easily accessible to our applications. And this is also where the API gateway gives us a RESTful API to connect into Elasticsearch and make this data available for integration. That normalized data is now stored on S3, and that becomes the foundation for the data platform, where we run all our algorithms. That includes risk adjustment and quality engines that comb through the data to identify patient conditions and care gaps. It also includes machine learning models that identify patients who have a high likelihood of benefiting from engagement with care managers. And importantly, COVID-19 risk algorithms that allow our customers to identify patients that are most likely to encounter severe COVID-19 symptoms. These are the patients that are more likely to require hospitalization and that are going to run higher mortality risk. One note I like to make on our algorithms is that our approach specifically surfaces underserved patients who might not be caught by traditional cost-based algorithms. And that's because we leverage additional information like social determinants of health. This means that we can identify a rising risk patient even if they're not yet getting expensive care. And that has really important implications for bias reduction and health equity. For all our calculations, we're still on S3, and all of this is running in EC2s, which are scaling up based on client size. We're also using Aurora RDS for our high-performance computations and data storage. All that data then gets exposed to our customers. We make it available directly through our analytics mirrors and in a series of applications for our end users. We've got a lot of interactive dashboards here that are built out in QuickSight, which allows our customers to build their own content as well. And all of that's on EC2s, and we're now doing a proof of concept around Redshift. Before I move on, I'd be remiss if I didn't call out that our security group works with our developers and AWS architects to ensure that data moves through this entire pipeline in compliance with our high trust certification. One of our key applications that I'll spend time on today is our engagement module, which leverages those stratification algorithms to generate patient cohorts and fire off texts and phone calls personalized to the patient. Our customers are able to use this to send very targeted messaging to their population. We're currently working with Twilio directly, but we're now kicking off a pilot around using Pinpoint to further leverage AWS tools to streamline this process. So let's talk about use cases. In the early days, education around COVID was paramount. Guidance around the pandemic was hard to follow. You might recall that a year ago, we were being told not to wear masks if we didn't show symptoms, which sounds pretty silly today. So sharing information from a trusted source was hugely valuable. Health systems could brand messages as coming from the patient's PCP to establish a better personal connection. And many organizations shared resources that went beyond just physical health, providing behavioral health hotlines to patients at risk of mental illness and financial support for patients who lost their jobs. Community Health Plan of Washington, a public programs plan based in Seattle, reached out to their Medicaid membership and reported its highest ever rate of member referrals following these campaigns, which was a great sign that this work helped connect underserved communities with the support that they needed. And health systems are spread thin, so the ability to reach out to just the number of patients they have the resources to work with is critical. And so is making sure that those patients are the ones who benefit the most. Intermountain Healthcare in Utah stratified patients by COVID risk and sent text messages to medium risk patients while doing personalized calls to those who were at greatest risk. Now, today, the focus has shifted over to vaccinations. Health systems have to combat vaccine hesitancy and get the message out about the vaccine and its safety, its efficacy, and its availability. Many groups are using outreach to invite patients to schedule vaccine appointments or ask them if they need a care coordinator to help them schedule one, prioritizing patients based on state and CDC guidelines and risk of COVID illness. At Intermountain, for example, this outreach has driven over 80,000 visits to their vaccination site, ensuring that they're able to get shots into arms with no doses going to waste. As we start to look ahead, the opportunities here are really broad. Many groups are already engaging with patients in preventative care, whether that's cancer screenings or childhood immunizations. And they're using broad data sets to identify care gaps and get personalized messages out to patients to ensure that they're receiving the care that's right for them. You've seen how our customers rely on these broad and expansive data sets to inform complex algorithms that are used to stratify patients, whether they're looking for patients eligible for the COVID vaccine or looking to understand which patients could benefit the most from care management programs for chronic conditions like diabetes. AWS enables us to bring in huge data sets and process them in near real time to put current and actionable data in front of our customers. Just having that data requires a level of trust. Our clients have to trust us, and we have to trust our vendors. AWS has extensive security and compliance certifications, and they make it easy for us to automate our provisioning for consistent applications of those security protocols. We can also provision new infrastructure in just a matter of days, and that infrastructure auto-scales. So we can jack it up when we're onboarding a customer and loading these huge historical data sets, but it scales right back down when we're waiting for the next data load. That manages our cost, and it also helps keep our security footprint to a minimum. And finally, AWS has fantastic white papers and tons of tutorials and other documentation out in the community that allows us to quickly understand how to use these tools. That's huge when we're working to bring new products to market really rapidly in order to support our customers. That sums up our story today. Thank you for joining, and check out our website at arcadia.io or reach out to us at hello@arcadia.io to learn more. Thank you.